I remember like one of your sort of first big initiatives was to work on a better customer health score because I think that helped to get a sense of like how much customers were actually adopting and using these products, right? And can you talk a little bit about that initiative and why that was one of the first things that you did?
Yeah. I mean, it was one of the first things that we did because we had so many customers and we had to figure out who needed us. And for the same reason that Lattice is sort of complicated in terms of figuring out like when is a customer live, like when are they out of implementation, the same thing is true when thinking about adoption because there are all these different modules. And what does healthy usage look like, right? Like one of our main tools is reviews. Is using reviews once a year more healthy than twice a year? Is it more healthy than like is 4 times a year better than 2 times a year? Like it sort of depends on the company. It depends on what they're trying to do in the product and like what their philosophy is and what their other programs are. There's like so much that goes into it. So it's hard to come up with like a brute force method of like, is usage good? So we really needed to come up with a thoughtful health score methodology that like accounted for the nuance and like complexity of the Lattice product set. So that was a really big focus and something that we have invested a ton into and we continue to invest a ton into. I spent an hour on V4 of the health score yesterday. And ultimately, what we did was build a model that takes lots and lots of different product adoption signals, looks at the correlations to retention, and builds a really like relatively complex scoring methodology based on what the customer has purchased and how they're using different elements of our product. The thing that is most important about its design is that it is highly predictive of retention, but it's not overfit. Like sometimes you'll see these health score models get built where like they're wildly prediction of retention. A lot of times people use red, yellow, green, right? And it's like they're super predictive of retention, but like only 5% of your customers are green and 10% are red and 85% are yellow. And you're like, well, how the hell am I supposed to use this? So like we also needed to design for a distribution that allows for like sort of a thoughtful approach to how we manage our customers. So this is something that's like evergreen. We're constantly working on like, like Lattice ships product every day. Like we have constantly shipping new product. So we're also constantly having to update the health score as soon as we can on like, okay, you know, we have this new thing. It shipped 6 months ago. We've got like sort of material traction of usage. How does that impact the sort of health algorithm? And that's just the adoption piece. We also have health scoring that goes up to sort of 1 mega score that is driven from customer self-report, like NPS, CSAT data, and then like anything that we can tell from like macro factors, like looking at sort of their employee trend or anything about like their firmographic that would give us sort of intelligence.
Yeah, it was a really great initiative because it just added like some structure to the chaos of managing all of our different customers and what's going on. And I remember there were so many funny debates at the time, especially around product adoption, where, it's like, oh, they only use the product once a year, but then they keep renewing. And it's like, wait, that's weird.
Yeah.
Where somebody else is using it more and then maybe didn't renew. And so it's like, it's so interesting to figure out, okay, what they buy. It was a very complicated thing to sift through. And yeah, I'm sure it has come a long way since I
It
left
has.
Lattice.
It
Yeah.
has. It's extremely powerful.